They say that true confidence comes from within, but the relationship we have with our own bodies is a complex blend of science, anatomy, and identity. Today, we are joined by a specialist in the field of plastic surgery here at NeoDerma Clinic to share insights into how this medical discipline functions today and the different services they offer here. So, Dr. Ian, thank you for making time to talk to IGIHE. How are you doing?
Thank you. I'm okay. Thank you for making time to come and see us.
Great. So I would like you to start by introducing yourself, what you do here, and how what you do falls into the ecosystem of NeoDerma Clinic.
Yeah, so my name is Dr. Ian Shyaka. I'm a plastic surgeon here. Thank you for coming.
Thank you, Dr. Ian. So we are here, we would like you to shed light on some of the things that we hear. But now that you are the expert, what is the difference between aesthetic, treatment and plastic surgery?
So for plastic surgery, this involves the use of surgery like sounds to collect or to refine shape or body or function. And this usually is more invasive than just aesthetic treatment, and doesn't require multiple treatments. And this most times gives more of a definitive treatment. So if I'm to give an example for each of the above, for aesthetic treatment, or things like Botox for taking care of one's wrinkles, things like fillers. Let's say someone has lost a little bit of volume on the face and we need to just do a little bit of touch-up with fillers. These are things we do in the office, maybe 30 minutes procedure, and then the patient will go home. But this doesn't last for so long. So after a couple of months, maybe they will need to come for another treatment of the sort. But for plastic surgery, we aim at providing treatment that is a little bit more permanent and in one session. Let's say one has loose skin, let's say big breast. So when we fix that with plastic surgery, then we don't expect to have multiple sessions of surgery later. Unless, of course, there's noticeable changes that can happen with aging, but shouldn't be very close to each other like in aesthetic treatments.
What sort of specific services do you offer here at NeoDerma Care as a consultant?
So here we offer both aesthetic treatment, which is actually it's part of plastic, but it's not surgical, but it's part of plastic. So aesthetic, those are office procedures, like I mentioned. That's Botox, fillers, it's laser for someone with scars and wants to improve scars. But then on the surgical aspect, as we go to surgery, then things like breast reduction, things like liposuction. Liposuction is when maybe someone has a stubborn fat somewhere and we need to take it out using very minimally invasive procedures to take out the fat or to reduce the breast size. Some people have really large breasts that affect their ways of life. You find someone has chronic back pain, they cannot find a suitable bra for their large size breasts. They cannot do exercises because it's very heavy, or they don't feel comfortable to go out there and exercise with a heavy chest. So all that, or there are some men you find there's a man boob, if you've heard of a condition called man boobs or gynecomastia in a more professional terminology, where a man gets breasts that are as big as for a lady. So we do that, we correct that, and that can really change someone's confidence and affects the way they live their life after that, and many others.
Yeah. Great. And as an expert in this field, what should someone know before actually deciding to take plastic surgery?
Yeah, that's also good, because plastic surgery It's a surgical procedure, and with surgery, every sort of surgery that one has to undergo is a big decision to make. So with such a decision, one should be informed, thoroughly informed. One of the things you need to know is to know what to expect in terms of the expectation should be realistic. Someone may see something maybe on social media and they want to be like that. So it's good to come, sit with whoever provider is going to do that for you, so that your expectations from the plastic surgery that you're going to have is tailored to your body and what can be achieved and what cannot be achieved, to avoid any sort of disappointments. That's the one. Yeah. So the other thing is you need to discuss with the surgeon about the risks involved. Are there any scars that are going to form with surgery? Because most of the things we see out there, you're not going to see everything online. You're not going to see the scars that someone had. You're not going to see what was done. So you need to understand, make the procedure your own, understand what's going to be done, understand how long it's going to take to recover, how long is the downtime, so that you can also plan. You don't have to plan plastic surgery, maybe a big surgery, when you have like a wedding to attend the next day, because most people think this is a quick fix. I will do this and look better tomorrow for an event. So those are all the things you need to discuss with your practitioner before you make the decision to do plastic surgery.
Great. And in this 21st century, plastic surgery is such a big word, and there are many misconceptions around it. What are some of the misconceptions as an expert you have seen or, people are talking about?
Yeah, plastic surgery is something that is really widely misunderstood out there. And that comes with so many misconceptions like you mentioned. One of the biggest misconceptions is that plastic surgery is only about beauty. That's not true. Plastic surgery is actually about helping one gain confidence, helping one to live a better form of themselves. Plastic surgery is not going to change who you are, but just going to refine a few things that maybe you do not like, but in a very realistic manner. And beyond cosmetic, plastic surgery involves, there's a part of plastic surgery called reconstruction. And actually that's a lot of what we do in our daily practice. Let's say someone has had a road traffic accident, someone has from the road traffic accident, maybe you lose a part of your body, or you have cancer, and after cancer surgery, you've lost that part that was affected by cancer. So it's through plastic surgery that we're able to reconstruct that part that has gone and bring back the shape and give you back the function. You're able to function and you're able to have the shape. And sometimes these procedures can be life-saving. And also one other misconception that people have is that plastic surgery is a quick fix. It's not a quick fix. It's a journey that you go through to finally realize your results. The journey that involves not only surgery, but aftercare, other supportive treatments that you have, and results. You don't know, just there are some results that you see immediately, but you're not going to see everything. You're not going to see everything all of a sudden. It takes time to heal. It takes time for the body to mold. It takes time for you to accept everything, for everyone to be happy with what you did.
Dr. Ian, talking about misconceptions, I guess we have come a long way. The misconceptions are not as much as we used to see in the 90s or 2000. How are people receiving the services today?
Yeah, so that's right. It's been a very slow journey for people to understand and get to accept this whole plastic surgery practice and discipline in general. Initially, people would shy away from even mentioning that they had some sort of plastic surgery. There was a lot of stigma around it. But I think with people understanding that they have a right to feel better, they have access to these services next to them. They can afford those services. So people, I think, are owning their own confidence, and they're not as shy about it as they used to be. And we are also telling them, because there are so many, like we mentioned, there were so many misconceptions. You do plastic surgery, you may get cancer. You do plastic surgery, this may happen. So all these misconceptions have, I think, have been clarified, and people feel safe with it. And as people do it and inspire others, if I may say, because they say, these people have done it. They are happier. They did not die. And everyone feels like something that can be done with minimal or with no regrets.
So, Dr. Ian, now somebody has done the procedure. How important is the aftercare?
Yeah, that's an important question. Like I mentioned, that plastic surgery is not a quick fix. That's what I meant by it's a journey. As a surgeon, you're going to do the procedure, but the aftercare is not actually an option. It's part of the whole journey of plastic surgery. So one needs to obey if they say you have to wear this garment for this time, this duration of time. Yeah, you need to use this medication for this duration of time. You need to do it if you need to do some massages, you need to restrain from some sort of activity, or in terms of which position you should do or not. It's all this will eventually count to the final result. So it is very important and not an option.
Dr. Ian, after all is said and done, how do we beat all the misconceptions we have talked about and actually encourage people to seek such services?
I think we now live in a very good era of internet, which can be a positive and negative thing, but we can use it to find out more. Now all the information is available to people. It's easy to know what is plastic surgery, what is done, what are the complications, what is this and this. And there's not much information that is hidden from people anymore. It's easy to access that information. I think that will help people to understand what really plastic surgery is, and also consulting. Consulting is always important, and to consult, you need to always consult a practitioner that understands and that is qualified practitioner for that, to avoid any further misconceptions, any misguidance or any complications. And I think in the end, this will help everyone to understand what this plastic surgery is about and what can be achieved with it.
Great. And I think that is an important area to end this conversation. Thank you for your time, Dr. Ian.
Thank you so much, and we're happy to have you. Thank you.
And to our viewers who have been watching us, thank you for your time. We appreciate so much. We hope you found this conversation insightful. Until next time, it's goodbye for now. I was your host, Wycliffe Nyamasege.